Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Apnea is is common among people of color, as among people, but people of color in particular, and it causes many problems. And the fact that you have to be on a machine at night is frightening to many people. But when you wake up every morning tired and you discover that CPAP can not only keep you alive but allow you to rest and let your brain recover from fatigue. This article talks about how he learned to love CPAP. I know some of you have had obstructive sleep apnea and had to take CPAP. Have you learned to love CPAP?
John Buchanan, have you learned to love it?
Oh, I love it. Oh yeah. I use it when I take a nap.
Really? That means you really love it.
You know, it's wild because as a child, I was always afraid to pull the covers over my head because I thought I would suffocate. But with the CPAP, I can pull the covers over my head.
Oh, isn't that interesting? Well, it's a great article, but he talks about how his first date, he had to wait until she went to sleep to put on his CPAP, and then after they talked about how horrible he sounds when he sleeps and the snoring, they were excited and happy that he put on his CPAP. But it's more the notion to have to put on a contraption to sleep at night. But when you're rewarded by having a good night's rest and waking up alive and alert and awake, I guess it feels. But now they're coming up with other ways of overcoming obstructive sleep apnea, not by surgery so much, but by other devices. So as time goes on, we'll see more and more about the ways in which obstructive sleep apnea can be corrected without CPAP.
What about the one that they can put internally in you?
I'm not aware of that one. Tell us about it.
I thought we learned about something that you could implant in a person who has that obstructive sleep apnea.
Not aware of that. I know there's surgery that they can do, and then there's Inspire and some other things, but I wasn't aware of any internal thing.
Okay.
I think the Inspire is the internal one.
Oh, good. Okay, the next thing was something that we know well about, I'm sure, because many of us not only are musicians, but also religious and Christians, and we learn how the vitality and the importance of forgiving. Sometimes people don't recognize that loving is one thing, but actually forgiving is as therapeutic as love is in terms of your health. We talk about exercise, we talk about meditation, but forgiving is something that is as powerful. And of course, one would argue that it's part of loving, but sometimes people will never forgive you for whatever you did to them. And this is harmful to you. And in many ways, not forgiving is letting somebody's bad deeds overcome you and overcome your love for other things. And it's not healthy. And as we did our research in our project, we discovered that forgiveness is one of the most important characteristics that you can have. Any comments about that before we start our stuff? Have you all learned how to forgive?
Yep, I have. Because like you said, you're only going to hurt yourself if you hold it in. It's not good for you.
And what does the Lord's Prayer say? If you don't forgive them, he's not going to forgive you. So, yeah.
And forgiveness, I think forgiveness also causes internal stress within yourself And that's your mind is constantly on what that other person did to you. And unless you forgive them and let that go, you're just really killing your internal organs and making yourself sicker than if you just let it go. But it is sometimes for a lot of people, and for me, sometimes I got to talk about it a lot. And then I can let it go and then say, oh, well.
Have,
So,
have you have you forgiven your sister for saying you're just nosy? Are you
sure.
trying to help her through life and all she says about you is you're nosy? That hurt me. I don't know. It hurt me.
Well, at the time, but then, as I told someone else, if you understand someone and know what they really are, just like children say stupid stuff to you, and you'll just say, oh, they're just a kid. They don't know any better. Well, that's how I really treat her, because she's trying to say something and she doesn't quite have it. So she'll say something idiotic and I'm just going, oh, you poor soul. But it does right then, it stings. But after a while, I just say, oh.
Well, I think that's beautiful. Wonderful.
No, John taught me a lesson, and I want to use this. One time, one person, it was a high dignitary, had done something to me. And I was talking about the morning, noon, and night, just how evil they were and blah, blah, blah. And John just simply said, oh, that person must mean more to you than me or God, because you talk about them more and etc. than you do God or me. So you, and I thought about it. He said something else. It was a little bit more crass, but I can't mention it. Record it. But I thought about it. That person had consumed me. They had taken over my soul. And when I woke up in the morning, I thought about them. When I went to bed, I thought about them. And I said, I gotta let go, because I'm not gonna let this person control me like that. So once you think of like that, and just like the person who said I was nosy, I just look at it. I said, you're not gonna control me. I know you. I call a name and then I let go of it. I just say, oh, it's just them. But if you think of it that way, when somebody has really stressed you out, you're thinking they are controlling me and my emotions, and I gotta let go of this.
Well spoken. Okay, Mr. Buchanan, can you start the rounds? Unless there are other thoughts. I think Carol expressed it beautifully. John, thank you for opening our eyes.
Okay.
Oh yeah, this is hot off the press. The new Howard University president who will assume Dr. Wayne Frederick's position on September the 1st. This is interesting because he has never been to any historically Black colleges. So it's going to be interesting to see how the next 10 years unfolds. We can see he has a career of a lot of administrative areas, but none in historically Black colleges, though he's done a lot of work in diversity. So it's going to be interesting to see his first exploration into the historically Black colleges and universities. And he talks about the fact that he has written books, 7 books on the minority population. And so he thinks that's good preparation. However, writing or dealing with people of color may be a different story, but time will tell. So it's interesting. You can see he has a lot of experience with people of color and has written 7 books. And is beginning very humbly as he talks about reading about the history of Howard University, which reading does not prepare you for living with us, but it's a first step, and 50-mile marathon begins with the first step. So we'll keep our prayers for him and our eyes open and try to support him as he tries to deal with an issue and with students of all levels, from the middle schools to the undergraduate college to the postgraduate college, et cetera. And so it's going to be an interesting new challenge for him,
Dr.
which begins in
Callender,
September.
what do you think he's lacking in? Because being around blacks or whites, once you understand human beings, what do you think he really needs to be? Why do you think he really needs to be around black people? It looks like he's black enough, but I don't know. What are you alluding to about he hasn't had his experience with the black college?
Well, if you have you ever been in a black college?
Nope. So that's why
Okay.
I'm guessing
Yeah,
I'm
okay.
asking. What am I missing?
And you would really need to be in a historically black college to really understand the difference, because it's like night and day. What happens in my experience with I went to Hunter College, which is a predominantly white college. It was then, and now it's a minority college. And it was mostly Jewish. And it wasn't until I went to the historically black college that I understood the fact that I was on the outside looking in, and really didn't understand. I really didn't understand that there is a difference, which is like night and day. And I think the only way you really can understand it is to actually experience. To understand that much about dealing with us is the fact that we've been brainwashed for 400 years to thinking that we are inferior. And that plays out in the way we act towards one another. I've had a lot of people who act one way at Howard and they act a different way at other places. And so I think the experience has to be lived. It's hard to express, but it's a matter of fact that experiencing life in predominantly white schools and life in predominantly black schools is different as night and day. In many ways, it's very supportive because we try to nurture and prepare people who are going to leave the black community and go to the white community. And the nurturing is important because it's a relatively hostile environment in the white population compared to the black population, and especially in healthcare. But in general, I would say that's what I've observed, and I think and a lot of the undercurrent of the inferiority complex that we have plays itself out in us having the belief that the crab phenomenon, that if the crab's getting out of the pot, you got to pull them back down, and all that stuff. All that stuff there's a lot of stuff that we in historically black colleges don't talk much about because we're there, we're mission oriented. That's why we're there. And so we go through it and endure it and use it to help us to be the best that we can be. That's my.
Let me take a stab at it, and Dr. Callender, you can tell me if I'm on track or off track. Predominantly white institution like Carol and I attended, Indiana University, the professor, staff, teaches, treats all of their students in a detached manner. There's no mentoring. You either get it or you don't. They just don't care. But at a predominantly black institution, the from what I understand, the attitude is more mentoring. There's more concern about whether the student succeeds. There's more professor teacher relationship rather than just a detached manner, so that the student has much more chance of success. If you have somebody that doesn't get that, like say Dr. Vinson, he's coming from PY predominantly white institutions. If he transfers that detached manner of teaching to his students, that kind of defeats what HBCUs are all about. Is that on track or off track, Dr. Callender?
Excellent. I wish I could have said it like that. That's exactly what I meant to get across.
I also came from 95% Black high school to a 99% white college at the University of Notre Dame. And I got that. I definitely got that. Everybody thought I was an athlete because I was Black. I was a biology major, right? So, yeah, there's a lot of that. I didn't even learn about, you know, Black history, African American history, and you know, they never taught any of that. So I missed out on a lot.
And as an adjunct to that, if we care about the success of our children and our grandchildren, we really should encourage them to attend HBCUs as opposed to predominantly white institutions.
And it's interesting that many of our people of color do just the opposite. But I agree with you 100%. Okay, let's go to the next one. Oh, this I thought was important because we had a lot of questions at the time that we talked about the second booster. And so I thought I'd share some thoughts about this that I thought are important. I guess the first point I make here is that these are the new announcements concerning the COVID-19 vaccines. And the first one is that this is the second bivalent COVID booster, recognizing that this is only the second bivalent booster, and that all of the other boosters, all of the other COVID vaccines were not bivalent. The bivalent mean that this is trying to address the BA.4 and BA.5 Omicron variants along with the original strain of the coronavirus. The other virus, which is no longer utilized, did not target the BA.4 and BA.5 variants. And so that makes this bivalent booster different from the original, and is the one that is now used. So if you never got the bivalent, you don't have the variants covered with the coronavirus. So those of you who've gotten bivalent 1, this is the second one, and is advised is for everyone, but in particular for those older than 65 and immunocompromised patients. But the others are expected to have received the first bivalent booster. So even though I've had about 6 vaccine shots for COVID, it's only the last 2 that have covered all of the coronavirus variants. Any comments or questions about that? Because that's important to understand that this is now a bivalent COVID booster, which is only the second of its type that covers the new variants.
Yeah, Dr. Callender, I had my third booster in September of last year. So this would be the 4th. That would be my 6th shot.
Yes, that's correct. Yeah.
Okay.
But actually only the second bivalent one.
Right. Okay.
And that's what makes this different, that it's a bivalent. And that's a term that we use because we had a lot of discussion about that the last time. And it seemed to me that most people did not quite understand that. That's why I wrote this article for my church, because I recognized that it was confusing to many because they said they already got a booster.
Mm-hmm.
Yeah, you may have gotten a booster, but you didn't get the bivalent booster, which covers all of the various strains of the coronavirus.
So do you have to request it?
No, the only one that exists now is the bivalent virus.
Oh, okay.
All of the other viruses, all the other vaccines, all the other vaccines are no longer in use.
Okay.
So if you get a booster now, it's going to be the bivalent But many people are thinking, I've already gotten 4 or 5 shots. I don't need to get another one. Well, what we're saying is that if you haven't gotten the first bivalent, you need to get the second bivalent. Because some people stopped after the first 4 and didn't get any of the bivalent, then they're not covered for the BA.4 and BA.5 Omicron variants. Now, that first one was the CDC authorized it, and then actually the next day, FDA authorized it for everyone, the bivalent mRNA virus for everyone. And interesting, look at point number 4, only around 17% of the United States population have received the bivalent booster. And however, among the 65 and older population, uptake is close to 50%, but it's still not where it needs to be. And number 5, the FDA plans to shift to an annual COVID booster campaign the same way that we have our flu shots now, where they'll modify it according to whatever variants they have. Now, of course, what is really important is item number 6, that Health and Human Services announced a $1.1 billion program, which will maintain free access to vaccines and treatments for uninsured people. The insured people are covered, but those who aren't are covered as well because of the government covering us for that. And the Emergency Act, which has covered us up until this point, will end on May the 11th, which is next Thursday. And so that would mean that the free coverage would end at that point. Although if you have Medicaid, it will continue through 2024. And then finally, the CDC will also establish contracts that will provide Paxlovid and Lagevrio, the oral antiviral medications, at no cost to uninsured people. And we'll focus on reaching out to the underserved population. So this is good news in the sense that the coverage is there for the coronavirus and for the oral antiviral medications at no cost to the uninsured population. I wanted to make sure everybody understood. If you have any question at this point, it'd be good to ask them.
So do I understand it correctly that unless you're on Medicaid, that this bivalent booster is not free? It's
No.
only free up until next Thursday, or is this?
No.
Okay.
What I mean to say is that the act that covered it and made it free is up on May 11th. But number 6 is available now. And so everybody is covered because of number 6. And in addition, number 9 identifies that even the oral antiviral medications are covered now. So everybody's covered now. It's just by a different mechanism. Because if this hadn't been done as of May 11th, everything would require insurance. But because of number 6, we are all covered. Any other questions or comments about this? Because it does lend itself to confusion. I just included the reminder that the Public Health and Emergency Act ends on May 11th, because if this did not take place, then as of May 11th, we wouldn't be covered. But because of this $1.1 billion program and the CDC establishing contracts, we're all covered. Any other questions? Because I want to clarify it so everybody will be on the same page.
I have a quick question. So I'm concerned about the annual combination of flu shot and COVID shot. if I get it now, since I got my first bivalent in September, like 2 days after it came out, should I wait until September again to get it?
No, you should get the second bivalent shot if you're over 65 now.
Okay.
If you're under 65, you could wait. But if you're over 65 or immunosuppressed, you need to get it now.
Okay, well, I qualify.
Yes, those under 65, the second shot is optional. But for those, my advice is if you're immunocompromised, you should get it as well. Over 65 or immunocompromised, whether you're on steroids or anything like that. Any other questions before we go to the next slide? I want to be sure everybody understood that so they would know whether they should get the bivalent booster or not. I got mine Friday, last Friday. Okay, next one. That's interesting. I talked about the CPAP, and this is talking about now another. We know that CPAP is the gold standard, and we know that there are for people who have nasal and oral mandibular problems, there's surgery that can help. And we know that the problem with obstructive apnea is that you're fighting for your breath, and so you can't sleep. And that's an overstatement, perhaps, but actually your sleep is tortured by the fact that you're trying to get oxygen. And hypopnea is apnea is you stop breathing, right? And so we know that the best way to identify sleep apnea is go and have them evaluate your oxygen levels while you sleep. And so most people will go to a laboratory where you go to sleep, and they will check you while you're sleeping and identify whether you are getting enough oxygen while you sleep and whether you have obstructive sleep apnea. Snoring is one of the first ways you manifest it, but there are other ways. And so the new mechanisms incorporate headbands and other things that, and they point out that this is something that we already know. A third of adults get 7 hours of sleep a night, which is the minimum. And of course, that's even less likely among Black adults. And so the fact is that obstructive sleep apnea is predisposed to by many things, but obesity looms large. It's a comment I've heard. I don't worry about sleeping because I can sleep when I'm dead. And actually, that's not the case, because when you're dead, you're not breathing at all. So sleep is sleep. Death is different. So.
We lost Dr. Callender. You back now? Yeah.
Sorry?
We lost you there for a second.
Oh, okay. It's back now?
Yes.
Okay. Any comment on this from those who take CPAP and those who don't? Those who just snore and their roommate complains. Okay, let's go to the next one. Yeah, this is an article that talks about finally the nomination. We mentioned this last week. The nomination of Monica Bertagnoli as director. Of course, this requires the Congress to approve it. So she's not in place yet, and you never know. But she has great credentials, and she has a likelihood of becoming a good cancer NIH director. Of course, what is more important than that is the ability to interact with the public and the community. And so we'll see we'll see more of this as the Congress, the Senate interviews her and affirms her or doesn't affirm her. But this is tough to replace Francis Collins, who was there for a while, and almost all of the, I guess she's one of the first directors who's not a Nobel laureate, but she's got everything else. So we'll see what happens. Now, this is an interesting article. It talks about, now I don't know, any of you have EpiPen? But anyway, EpiPen is a medication they use for allergic reactions that cause you to have anaphylaxis, which means that if you don't get treated, you die. And one of the problems is that on the airlines, they do not carry epinephrine or EpiPen. And because of this is a patient who developed anaphylaxis and was dying. And if there hadn't been a physician on board who knew how to inject epinephrine, this patient might have died. And so the request now is to get the airline industry to have EpiPen as part of their medical kit. And so this is interesting observation, you know, especially since they serve nuts and other things that are allergic, cause allergic reactions. Having EpiPen available is important. And do any of you have EpiPen?
I don't, but Chris does. We've been a Catholic family all of our lives, and every Friday, the Catholic way, you'd have fish on Friday. So to Chris, he goes in the military, comes out, and he said, "Oh, I meant to tell you, from now on, I'm allergic to fish and I'm allergic to nuts." How do you get allergic to fish and nuts? We soon found out. Once we were out, he was eating off my plate, and he said, "What's that crunch?" I said, "It's nuts. I told you I'm allergic to nuts." And he's running. I mean, feverishly running. It was a drugstore across the way at the restaurant, and came back with Benadryl and gulping it down. I need to go to hospital. He carries an EpiPen, but he didn't have it. And we had to leave everybody, rush him to a patient first. And patient first, you sign in. And he was just too excited to sign in. I just yelled allergic. He's allergic to nuts. They ran out and got him. By this time, he's stripping. He's swelling. He's perspiring. How does that happen? Also, with the fish, we always had a habit, fish fry Friday, the Friday before Easter, we would have a big fish fry at the house. Chris wanted to continue that tradition. He did it, and I can show you pictures. Face out to here, lips, eyes. He said going overseas, they give you these injections, and he felt that did it. But he's truly allergic. But it happened while being in military. I just thought it was the strangest thing, but it's been proven he is allergic, and he does carry an EpiPen.
Right.
So I don't know what combination of shots triggered it, but it's evident that he is allergic. But he goes on with it, and half the time he doesn't take the pen, so I don't know.
Well, it's life-saving.
Yeah. So I guess it's not anything you're born with, at least not with him. And but it had something to do with those injections going overseas, a combination of them.
So, Dr. Callender, if a flight attendant had an EpiPen, they'd have to have training on how to use it, right?
Well, if you have EpiPen, all you have to do is inject it because
Yes.
the instructions are there. Whereas with epinephrine, you have to assemble the whole kit and do everything.
Mhm.
That's the advantage of having EpiPen because it's all set up and you just inject it.
Okay,
And
so
that's
there's no risk of injecting it incorrectly.
no, not with EpiPen because you inject it in the
The stick.
subcutaneously in the muscle or whatever, and it works immediately.
Mhm.
And that was if they didn't have a nurse or doctor aboard, that might have been disastrous. So we're hopeful that the airline industry will take note and make that correction.
So what you're saying is that doctors carry medical equipment with them all the time?
No, I didn't say that. No, I'm saying that they had other equipment that allowed them to use other things, but they did not have EpiPen and they didn't have epinephrine. Right, so they had to use other medications because doctors do not carry medication with them.
So how did he get it? You said this physician saved his life. How?
Oh, because he was able to give him other medications and things like Benadryl, as she had mentioned, and other things keep him alive until you can get the epinephrine. And then when they bring in epinephrine, then you have to be able to know how to inject it. Whereas with the EpiPen, it's already put together and you just take it and inject it directly. So Benadryl, as Janice mentioned, is good to get things to
Under control.
control it a little bit, but it doesn't completely do the job like epinephrine. Epinephrine does it immediately, whereas with Benadryl and those things, they slow it down, but epinephrine actually stops it. Because first your tissues swell up and then your vocal cord swells up, and that if your vocal cord swells up, you can't breathe. You're down. Yeah. Now this is an article about a COVID AstraZeneca person who died from injection of COVID, and this is from a combination of brainstem infarction, bleed on the brain, and vaccine-induced thrombosis, which is not reported with any of the other vaccines. And so this is just for those who are anti-vax people to know that there has been an association of one vaccine with fatal reactions, but that this is apparently the only one. And this was a doctor who took his vaccine as recommended and died from it. Just to let you know that some of these anti-vax people will keep this in mind and forget about the other millions who have been helped by it because of the death of one person, which is, if you have somebody in your family who is hurt by it, that clouds your thinking for everything else. And that's why some of these anti-vax people are like that. That's why distrustful.
Dr. Callender, last week, last Thursday, as a matter of fact, had to rush Shelby to the hospital. The day before, she had gotten her vaccine, which was the most current one on the market that you had just spoken of. And what had happened is that she had lost consciousness for a while. Her blood pressure dropped severely, and the ambulance came and looked her over. And by the time they got there, she was coming around. But he suspected that it had to do with the vaccine that she had gotten the day before. When they did get her to the hospital over in Virginia, they did realize that all of her tests were positive, were negative, and her X-rays, they were good. They couldn't find anything wrong with her, and the only thing that they could link it to was the vaccine that she got the day before. But she is fine now, up and running around, doing her normal things.
Okay, all right. Glad to hear that she's well.
Thank you.
Okay, thank you. Thank you for sharing. This is an example of a girl who was choking at a baseball game, and it tells the story of how the doctor in the house went over and tried to administer the Heimlich maneuver. And after doing it a couple of times was unsuccessful, but persisted, and eventually was able to block whatever it was that she swallowed that was choking her. Because in the event that that doesn't do it, then you have to do an operation in which you open the windpipe and get them to breathe. Because the Heimlich works in maybe 90% of cases, but there's 10% of cases in which it isn't effective of dislodging whatever is obstructing the airway. And this is what happened in this particular case. And he persisted. His injury, he did the same Heimlich maneuver about 10 times before it actually worked. Yeah.
Dr.
Where's my-
If the Heimlich routine doesn't work, do you actually have to open up a hole in the person's chest?
No, the windpipe. The tracheostomy or the hole in the windpipe is what you do. You make a
Okay.
hole in the windpipe. Yeah.
And
Right.
so I've seen it on TV. And you know what TV's like. They didn't have any tools or instruments to actually open up the hole in the trachea, so they used whatever they had. I think they had a writing pen or something.
Yeah, that's right. Yeah.
That's television, though.
Yeah, yeah, it's frightening. I actually had to do that on my wife on our, we went on a cruise, and she, no, I had to do a Heimlich. It was effective though, so I didn't have to do anything else. But if the Heimlich does not work, then the next thing that you do is to make a hole in the windpipe. But then you need somebody who knows the anatomy to know where to make the hole, and they can breathe that way.
Yeah, on a cruise, they would have some utensils, that you could probably use from the kitchen.
Yeah, fortunately, just one Heimlich maneuver and whatever it was popped out, and she was okay.
Yeah, the name of John Buchanan's band is called Proper Utensils.
Really?
Yep, that's the name of his band. Proper Utensils.
Wow, that's an interesting one. So anyway, it's just interesting to know How long are leftovers good for? Well, I think this is important because what do you do with leftovers?
Oh, my way.
Put them away where? And do you refrigerate them? Or yeah. And most of us know that you refrigerate them. And some actually even put them in the freezer. But the question is, how long is long? And when you should know within 2 hours of cooking. And how long will they last? Usually the
In my
fridge is
house,
well below 30. What'd you say, Janice?
I was saying in my house, Chris and the kids know we have a Thursday rule. And when the kids were young, they said it's like that song, clean up, clean up. Thursday, I look in that refrigerator because Friday's trash day. It's gone. Chris will eat stuff a week, 2 or 3 later. And Thursday rule, if I can get to it, it's gone.
That's good sense.
Yep.
Common sense. Yeah. Yeah. Well, because you have a tendency to put it in the refrigerator and think it's going to stay forever, which is not.
Yeah. Mhm.
Yeah. One of my refrigerators has a temperature control, and I set mine at 37. They say that's the ideal temperature for refrigerators.
Yeah, under 40 degrees. Yeah.
Yeah.
It says up to 4 days in the fridge, 4 months in the freezer.
Mm.
Appearance, how to tell if they're bad, smell, taste. Wow.
Mhm.
And yeah, wow. Yeah, I guess we've all been there, huh?
Yeah.
Taste is in third place. I'm glad at that because, you know, you don't want to taste something that's too bad.
Right. Within 2 hours of cooking. Anybody violate that rule? Why'd you skip over the last one? Okay, any questions about it? If not, let's go to the one you keep slipping over. Oral sex is fueling an epidemic of throat cancer. This is something that I think Michael Douglas, or was it Kirk Douglas? One of the Douglases was the first to come out. Was it Michael?
Michael. Mhm.
Michael.
Yeah. Who
Yeah.
came up and talked about the fact that he had throat cancer because of oral sex.
Mhm.
Cunilingus is the term for it. And it is now one of the, because of the human papillovirus that is found in the vagina, is now one of the main causes of oropharyngeal cancer. It's interesting in the sense that most of the HPV comes from men anyway, and they give it to men, and this is a situation when the man gets it back from the female, so that it's interesting. 70% of those cancers are caused by HPV, which is found in the vagina. So oral sex, and I think Darryl talked about one of the other things that people were doing, which is having oral sex with the anus, which is another variety on the theme. But HPV is actually the most common sexually transmitted disease. Yeah, so we have to keep that in mind. So, and also that the HPV, I think, was mentioned in the talk earlier, is now given up to the age of 45 for men and women. Yeah, because while it causes oropharyngeal cancer, it originally was identified because it caused cervical cancer, which is killing many women. Yeah, so.
Dr. Callender, this is Sylvia. Good morning, everybody. So you said this is from women. What about when men have oral sex?
No, I said, I'm talking about men having sex with women.
I'm saying men having sex with men.
Oh, that's that, yeah, well, that, then they have, usually they have, HPV, most of the HPV that causes oropharyngeal cancer is thought to be related to women. I didn't say it can occur in men or women. It's just that,
Oh, okay.
yeah,
Oh, all right.
I wasn't eliminating that. It's just that HPV in men often is associated with anorectal uh, uh, papillomas and other lesions that are commoner in men than is the oropharyngeal cancer that occurs from women. But it can occur in men and women, it's just that it's more often. The HPV that men get from men is more often associated with the anorectal and other growths that you see on the anorectal area.
Oh, okay.
Dr. Callender or someone on the panel, how do you think they're gonna publicize this? Like they simply said, smoking cigarettes give you throat cancer and lung cancer. So the publicity of this, how do you think that this will be?
This is how you do it.
What?
Call it out. Oral sex is fueling an epidemic of throat cancer.
Oh, okay.
That's now, are you suggesting that people don't understand what we mean by oral sex?
Yeah, they do, but I don't know. People are very squeamish. I don't know. Just talking about, I've never heard that. You're hearing everything on television, but this has not broken through on television yet or advertisement. I haven't seen it anywhere. We've
Well,
talked about this before.
yeah, but I thought Michael Douglas was the one who popularized it. But as you said, it kind of dwindled off and nobody has said more about it. But now this is an opportunity for us to talk about it, because I think you're right. Most people don't even want to talk about it.
I think what they're going to do is come up with a new drug and advertise it on TV. And at the same time, indicate that people won't discover what you have. Because they do the same thing with that other medicine. They said you can't discover, you can hide it. You can hide the fact that you have this disease by using this drug. I think you all know what I'm talking about.
Well, there's no such drug right now. The
No,
only treatment for oropharyngeal cancer is surgery and radiation. So popularizing this is the way to do it. The question is, how else do you do it? And so, as we talked about last week, getting the public to recognize the importance of this is a far cry from just having one article like this published in a physician the doctors see. And I think what Carol is talking about, having it so that people recognize that cunnilingus, for example, they don't say cunnilingus because that is specifically saying that you have oral sex with the vagina, whereas oral sex to some may mean something different. But that's exactly what they're talking about, cunnilingus, where you have a men licking the clitoris. And that specifically is not what they're saying, but that's exactly what they're talking about, how it's transmitted. Any other questions? Is that medical language kind of confusing to you? Or, but that's what oral sex, what they're trying to talk about. I think Darryl mentioned about oral sex with the anus, oral anal sex, but they're actually talking about oral vaginal sex. Any other comments about this? It's not, as Carol said, this is not something that people tend to talk about. On men, I remember when I was growing up, if you talked about men having oral sex with women, that was, suggest that you were incapable of having an erection. And then so they put you down for that, although your mate might not put you down, but the men would put you down for it. So anyway, any other comments about this? Because I think Carol is right. This is one way of publicizing it, but that's not the best way. That's not the way you educate the community about it.
Yeah, we got to recognize that things have changed from when we were growing up. We got a lot of kids now that say, I'm a virgin, but they participate in oral sex. It's called having friends with benefits. And so, oral sex is kind of much more rampant with the young kids than it was when we were growing up. And they have a very cavalier attitude towards it, not realizing a lot of the inherent dangers.
What Darryl is saying is true. When I was teaching Sunday school and I had a wide open class, like we would talk about how many of you have ever been high or dizzy or had wine coolers, and then they would raise their hands. And then one child just off the cuff asked me were they still a virgin because they had oral sex? And that sort of, and that was back in the 90s. And it sort of threw me, because I had never thought of that before. And these were middle school children. These weren't high school kids. So what Darryl is saying is absolutely right. But most adults and most, adults, when they talk about it, there is behind in a closet, cloakroom, and they don't want you to repeat it. But children, they had the question, and that's one of those hard subjects that you approach.
This is
Well,
a startling statistic. Young people ages 15 to 24 are responsible for nearly half of the new STD infections.
the approach should be just have them talk to their Uncle Darryl.
Everybody doesn't have an Uncle Darryl.
Well, even if I'm not their uncle, I am available to talk to all young people ages 15 to 24.
Okay. Look at this. 41% of teens participate in oral sex. That's a pretty high number.
That's because in sex education in school, they had so much about, the sexual diseases and STD, so much that kids think that they cannot get it through oral sex. If they do oral sex, they will not get syphilis or anything else that's on the horizon.
Well, they will get HPV. So, okay. All right. Well, I think this is very informative, but I think your point is well taken that this is not enough to educate the people in the community. This may be okay for telling the doctors, but not for the community. Okay. It's interesting. The more we talk about the fact that obesity is present in almost close to 50% of Americans, and the more we come up with new drugs, and the number of drugs that we come up with, along with the Ozempic and Wegovy, the bariatric surgery is all aimed at one of the biggest problems in health today, which is being overweight and obese. And these new drugs are thought to be an easy way to lose weight. And this then is the new wave. Although it's not really a new wave, because we have medications to lose weight ever since I was in medical school. Dexedrine and those other drugs. That's what they were originally touted for. They were used differently, but they were touted for actually losing weight and suppressing the appetite. So we have more new drugs coming, Ozempic and other drugs. Can you imagine $10
Callender,
billion? Yes.
It seems like historically all the weight loss drugs have been especially dangerous. Historically.
Yeah, that's true. But even everything has its side effects. Bariatric surgery has its side effects. These drugs have their side effects. Whoever heard of diet, exercise, and willpower? The easy way is take the drugs. And of course, the next way is the bariatric surgery.
The worst side effect for bariatric surgery is the people gaining the weight back.
That's not the worst side effect. Worst side effect is death. That's the worst side effect. But another complication is losing weight, but it's just not the worst. The worst, people die after. Some people have died after bariatric surgery.
Yeah, Doc, I had a friend, scuba diver friend, who had it. He lost like 100 pounds. He was probably like 380 or 390 before, and he was down almost 200. And like 3 months later, he died after the bariatric surgery.
Yeah, it's not common, but it also cures diabetes. It does many positive things, but when you talk about the worst things, death is the worst thing. And it's not common, but
Yeah. My sister needs hip replacement. And one of the surgeons she went to suggested that she lose some weight. At their hospital, they're guided by the BMI. She decided to do that. Lot of pain because she's been going through this need for hip replacement for a couple of years. And so she chose to try to lose weight. And like most surgeries, before you have the surgery, you see a slew of doctors. And one of the doctors that was given his pre-approval or getting her prepared for surgery suggested that she take Ozempic, but did suggest talk to your primary care doctor. And, oh, you can lose that weight in a couple of weeks. And she thought about it and she said, no, I'm gonna hang in there. So it took her months, a good 5 months to lose 20 pounds, but she was proud of herself. She did it and she's scheduled for surgery on Monday. Now she's afraid that the cardiologist hasn't really given clearance for her to have it. And so I'm telling her, hang in there, you just might have to have that test all over again. But she didn't take that short route of taking Ozempic. And people are pushing it now. It's supposed to be the quick weight loss, the miracle drug. So I applaud her for doing it her way, but she is in a lot of pain. She needs it.
Okay. Any other comment about that before we go into this weird article? This is a lady with end-stage renal disease who actually needed a kidney transplant, and her dog stuck. They had a conversation between the two dog owners, and the dog Doberman kept coming back, and they finally talked about the fact that she needed a donor, and they tested her, and she turned out to be a perfect match. And eventually she had the transplant, and here she is now having successfully received a transplant because of the Dobermans. Interesting story. I never had anything like that before. Dog sniffing out a perfect donor. That's so you know, it's amazing how things happen. 1 in a million, 20 million chance to find a perfect match, and that's what they found. Who would believe such a story? But that's the way it happened.
Yeah.
That's weird. I thought it'd be interesting for us to see something that is more unbelievable than life itself.
Yeah, Dr. Callender, I think it highlights one of the aspects of dogs' oral or nasal sensitivity. They use dogs to sniff out just about everything now.
Yeah.
They can be trained, and that dog owner, the owner that sniffed out the other person knew that was a match. I mean it's just like almost like an allergy. It's like the reverse of an allergy, right?
Well, I thought I'd share with you
They would recognize that even a genetic trait in another person.
That's really something. That's quite a story.
Well, okay, this donor registered as a organ donor. There's no mention in the article for whether or not she just gave away the kidney or sold it. But I'm reading the
You can't
internet that
sell it in the
says,
United States.
well, okay, internet. I did a search for how much can you sell a kidney for, and it says up to $10,000 a pop. So that might be an international price. But
Yes, correct.
if you need $10,000, like I need a new roof, so I've got to think about selling one of my kidneys. Maybe I can get a new roof.
But you'd have to do that in another country.
And
Many countries, it's legal. It's not
Well, they
here.
may pay for my travel.
Oh, they would. Yeah, no. That's exactly what has happened. And people have gone to other countries to get an organ. Heart. The guy in Florida, he got his heart in England. And so you can go to other countries and buy organs. That's true, but not in the United States.
This was in England,
Yeah.
UK.
Yeah, well, Darryl, you can get a dog to sniff out the best contractor to do your roof.
Well, we haven't identified that this is actually, this dog did it. We haven't identified that any other dog could do it. I mean, this is a 1 in 22 million situation.
John, you can't be serious about that.
He's not. Okay. Top 5 best medical specialties for extroverts. Interesting. Psychiatry, family medicine, internal medicine. That's the question is, what is an extrovert? What's an introvert? Extrovert is somebody who was willing to indulge with others. Introvert is somebody who stays within themselves and is not likely to work along with other people. And psychiatry is interesting, the area that they say is most suitable for extroverts, people who express themselves. Psychiatry is a field that you have to have a certain special gift to be able to deal with people who are mentally ill. So it's not just going into a field because it pays a lot. You have to really have a feel for it. Family medicine, of course, is like the old doctors used to be. Used to go to your home and see you. who really care about the whole body. Pediatrics, of course, is more about dealing with children. Then, of course, after that is, what is it? Emergency medicine, internal medicine. Yeah, well, which is the next common field, which covers a gamut of medical issues. And then fourth, they have emergency medicine. The difference with emergency medicine is that you don't get attached to the patient. You see the patient, take care of the problem, and they're gone. The other specialties take care of patients all the time. Whereas in many ways, the emergency doc deals with them, and then they either send them into the hospital or they send them home. And other people take care of them for the rest of their lives. And you see their salaries, they make good salaries as well. But it's interesting, most of the salaries that they list here, certainly more than the average salaries. And then, of course, there's the leadership roles that actually, for example, you have Dr. Frederick, who's the president, who makes over $1 million a year. So, and there are other jobs, leadership positions that pay more than just taking care of patients. So these are those who wondered what doctors make and what specialties. You notice none of these, they didn't have surgery in any of them. But anyway. And
Well, I'm looking at top 5 best medical specialties for introverts. And surgeon is listed there. It's radiology, pathology, anesthesiology, surgeon, and non-clinical medical careers. Big difference between extroverts and introverts. Extroverts say, I want you to like me. Introverts focus on the task at hand and don't really care if you like them or not. So you probably want your primary care physician to be an extrovert because he wants the relationship. He wants you to like him. But you want your best surgeon to be an introvert because he's going to focus and do the best job.
That's one way of looking at it. Yeah. Okay. It's interesting because I think it's a mixture that is so important. But I think what you said makes a lot of sense, except that as a surgeon, I'm very holistic, and I want to take care of the whole patient, and I always have a relationship with my patients. So I think characterizing one as an extrovert or introvert doesn't take into consideration the whole story, but it's an attempt, though. It's an attempt.
Right. And it's not an either or situation. There is a category for an ambivert, that's the person who is equally extroverted and introvert. And then there's all variations in between. And so it's not either or that you're either an extrovert or an introvert.
Well spoken. I agree.
The other thing, I don't understand if a liver transplant costs in the neighborhood of $500,000. Who gets most of that money?
Most of that money goes to the administration of the treatment, whether it's the hospital or mostly the hospital and the administrators. It doesn't go to the doctor. Now, this is something that is really appropriate. Loneliness poses a risk as deadly as smoking. And I think this is so important for him to share. Half of the United States adults experience loneliness. And just like forgiveness, the loneliness is poisonous. Just like being unforgiving is toxic. Loneliness is toxic. And the number of single households has doubled over the last 60 years, whether because of loss of life or divorce or whatever. Loneliness was worsened by COVID and the isolation. And so groups like this and other situations are important. But what is frightening is the fact that people from age 15 to 24 have been especially hit hard, and the teenage suicide rate and other things are accelerating rapidly. So that this is even a greater risk than stroke and heart disease, which is saying a lot. The depression, anxiety, and dementia that goes along with this is frightening. And there's no question that technology has made it worse when people want to spend more time with social media than they want to spend with each other. And this is so frightening. And so as we move to more technology, and you see these mass murders and other things, they have no relationships. And so loneliness is, as he said, like smoking and obesity. It's something that we really have to spend more time with. And it's just the opposite of what we're doing. We're becoming so technology oriented that even in the practice of medicine, the art of the practice of medicine has been taken away by some who will spend more time with the lab results than they do with the patient. And so that this is, our times are threatening to become more robotic than human. And this then is a move in the wrong direction. Any comments about that article? Because that is, let's go back to that article. That is a frightening article. Let's go back to that other article. Yes. Yeah. Is there any other comments on loneliness? Janice, did you want to say something? No. Okay.
Okay, one thing also for teenagers and a lot of parents, I had one pediatrician to tell me, when your teenager wants to be alone all the time and etc., let them be alone, let them go in the room. And I did have one child that did that. And I said, no, I'm paying for this. Anyway, open the door and you're going to interact with the family, whether you want to or not. Because I believe that every human being from infancy to old age, that we need, if it's possible, interact with others, and all the downtime and being alone is really no good. But a lot of times, and I don't know why this pediatrician said, if they want to be alone and stuck up in their room all day long with the doors shut, let them do it. And I really admired that pediatrician until she opened her mouth and said that.
Well, I couldn't agree with you more, Carol. Yeah, I couldn't agree with you. Any other comments on the subject about loneliness?
I don't.
You know, I was in a hospital for 18 months, and it prepared me for dealing with loneliness, but that does not make it desirable. It makes, you know, if you have to deal with it, that's one thing. But to making that as a choice, that's another. And even the good book talks about, Ecclesiastes and Proverbs talks about the fact that it's important to be with someone else. Why did God make Eve for Adam? Because he needed to have a partner. So that loneliness is the antithesis of what was ordained. Any other comment on the subject?
Yes, good morning, everybody. I'm sitting here with my husband and he's saying, yeah, I'm lonely, but I'm trying to let him know that just because he likes to stay home does not mean he's lonely.
He has a wife.
He has a wife and grandchildren that he bugs all day long.
Where's
Plus he's
Steve?
on the phone.
Where's Steve going?
So he is not lonely.
Well, he is not, he probably wants more social interaction.
Go
But that's
ahead, Doc.
different from being lonely.
Go ahead, Doc.
Don't help him out, Dr. Callender.
That's different from being lonely.
Go ahead,
No.
Doc.
He is
Lonely
not
is
lonely.
alone.
Yeah,
That means you
lonely.
have no one.
That's right. That's exactly right.
That's how I feel.
No, you don't. Okay.
Well, one day, hopefully you'll not find out what loneliness is.
You heard that, didn't
I'm going through it now.
Well, no comment.
Yes, it sounds like he just wants his wife to stay home all the time.
you? With him, and that's not happening.
No way.
I get another way.
No, you won't.
Well. Pearlie, did you want to say something?
No, I'm just joining in.
Good to see you.
Good to
Nice
see
to
you
see you.
too.
Yeah.
Good to see.
Okay, any other comments about loneliness? We've heard from a man who's not lonely, but it's, can you be lonely in a group with 10 other people? That's the question.
No.
Yeah.
Yes, she
Yeah.
can.
Yes,
You
you
know,
can.
you can. I believe
Yeah.
that you can,
Mhm.
especially if they're just acting like you're there, a fly on the wall or something, and they're not even acknowledging that you're there and talking. You can be around a whole bunch of human beings and still be in a shell and no one is interacting with you.
But not if you make yourself the center of attraction.
That's correct.
You needed me.
If you're at the center of attraction, it's tough for you to be lonely. But you know, when you think about comedians, you know, you see comedians who are the center of attraction, and they kill themselves often, and you wonder about that because while they're in the center of attraction, but then after the act is over and they're still all alone, they still can be lonely. So.
Yeah. Let's see. For a couple of years, I did a lot of stand-up comedy, and you know, like when you travel on the road as a comedian, you're always on the road, completely with strangers. You go back to your hotel room after the show is over, and so that's a lonely life being a comedian.
Mm-hmm.
Interesting. Any other comments on the subject? It's a very fascinating subject and worthy of dialogue and discussion. Any other comments about it? That perspective that Darryl gave is very interesting to hear firsthand.
What about the part, him being a comedian or that he was traveling or what?
The fact that he was a comedian and that it was a very lonely life, because comedians have a track record of suicide.
Yeah, a lot of big
The-
stars are lonely too. I've heard that Michael Jackson said he was lonely.
yeah,
And yet he
the-
performs, you know, for millions of people.
Yeah.
Good. Good not do.
Any other comment? If not, we'll do the next one, but it is interesting that you can be lonely and still have a lot of people around you. What is happiness? How can you be more happy? And I guess the question is, are you happy?
Mhm.
How many in the group are happy?
I'm happy.
I am. I'm very happy.
too.
I'm very happy.
Yeah.
Happy wife, happy life.
I am.
I'm content.
Content.
Happy.
I am too, happy and content.
So many of you are happy, and
Yeah, happy. Yeah.
Yeah.
My wife's happy, then I'm happy.
Isn't there a song? If you're happy and you know it, raise your hand. Or clap your hands. If you're happy, you know it, clap your hands. That's a kid's song, isn't it?
Yeah.
Right. Well, it's interesting how that Finland is always number one and the United States is about 15. So they asked the question, why is it every year Finland is number one? What makes people in Finland so happy? And and they talk about family, good friendship, spending time outdoors, enjoying a cup of coffee. Interesting.
And coffee.
Yeah, nature. Well,
Mhm.
I think when push comes to shove, what really makes people happy is be able to do what they think is the most important thing in their lives, and being able to accomplish what they set out to do. If you have set a goal in life and able to reach that goal, then you can be happy. If you set a goal in life and you aren't able to reach that goal, it's difficult for you to be happy. Now, money does not necessarily make you happy, but being able to accomplish whatever goal you set for yourself may. And for me, my faith in God has made it possible for me to be happy. Without my faith in God, I wouldn't be happy. But everybody else, we have many, perhaps agnostics and atheists who may well be happy. So one man's meat is another man's poison. So that's why it's interesting to hear some of you happy people. Tell us why you're happy. Told you why I'm happy. Why are you happy?
I'm retired.
Well, retirement may be a source of unhappiness for some.
Thank you.
Yeah, I'm saying, but for me, I'm happy because I'm retired. That's part of it.
Oh, that's great. For some people, the goal in life is to be retired. So, okay. Anybody else? Tell us
Well,
why they're
I'm
happy.
happy. I'm happy because I work out 3 to 4 days a week. It gets my endorphin level high, and singing makes me happy. I'm also getting married in August, and so that makes me happy. And more importantly, I stay away from social media. I don't. I spend hardly any time with Facebook other than posting my gig notices. I spend very little time with YouTube, and I don't watch TV. Americans are most unhappy than other countries because our media and social media is unregulated in America, and all they sell here is fear. They want to make sure that that the left is scared to death of the right, and the right is scared to death of all the crime on the left. And you don't find that in the Nordic countries and most of the rest of the world. They regulate their social media, including all of the Facebook, TikTok, Instagram platforms that are just the wild, wild west for us. They regulate their media, and we don't do any of that because we have the best money. We have the best government that money can buy.
Well, what do you think about the fact that in Finland they had a relatively high suicide rate?
Well,
Well,
wouldn't
that means
you?
they're
It's cold
happy
up there.
What'd you say, Carol?
They're not really that happy,
It's just what I was getting ready to say.
but it's according to how they're basing on what happiness is.
Yeah.
It could be, it could be that they're so happy that they're ready to go to the next world. I don't know.
Okay. Any other comments about why you're happy?
I'm
Dr. Callender,
retired.
this
I
is
like to-
Rochelle.
Mhm.
Like you said, accomplishments, my health. I'm a breast cancer survivor. My faith. I'm an avid learner, so I like to learn. You learn something every day. So I am alone, and I'm crazy about me some Rochelle. So I'm at this point in my life, I'll be 71 this year. I'm living my best life. And I have
Wonderful.
accomplished something that no one in my family has done, is to live to be this age.
Congratulations. Anybody else want to tell us why they
This
have?
is, this is Janice. I'm happy because I'm retired. I like to socialize. I like to have people around. I love having people in my home. I live alone now, I think, Dr. Callender. Chris has moved out. When he was here, the kids be here 2-3 weeks at a time, gone 2-3 weeks at a time. Kayla's home from school. Grandma be there Sunday morning for breakfast. So it's those routine things that keeps me happy. Every Sunday I fix a good breakfast or a big breakfast. I don't know how good it is. They like it. But I'm alone, but not alone. I'm like Rochelle. I accomplished something that my other siblings have not. I've had 4 siblings preceded me in death. They didn't make it to 70. I'm 73. I'm happy. I'm living a good life.
Anybody else? Anybody else happy?
Yeah. I'm happy almost all the time, except when I'm sick. When I'm sick, I feel very miserable. And that's where, you know, I begin to regret, you know, my life. But other than that, I feel happy most of the time.
Anybody else? Elizabeth?
Yes.
Elizabeth?
Good morning, everyone. Yes. I've always been happy. You know, they used to call me when I used to go visit my parents on the Gulf Coast. I would go to Sunday morning. I would get up. You know the song that says Sunday morning. That's my favorite. And I would. We've always. My mother's always planned it. The climax of the whole week was Sunday morning, and so when I moved away, I would go visit my parents, and I would start off with I would go to church with my mom, and I would stay there after the preacher preached. I would leave and go to church with my daddy. After that, I would because I realized, I told my husband, I said, the best way to see all my friends in one spot is at church. And so I would leave. My father he became a Christian late in life. And when he would see me, oh, his smile would be a mile wide. And I would go, even though he was sitting in the deacon corner, I would go sit right up under him as if I was a little girl. And he would be so overjoyed. He'd have had a heart to tell me I was in the deacon corner, but anyway, they would say, that's just Elizabeth. And I would leave there and I would catch another church in the community where I knew their service was a little longer. And I would go and greet everybody in that church. And when I finished on that Sunday, I would have met everybody I grew up with. But I'm looking forward. My mom is 97 years old, 97 years young. And I'm looking forward to that long life without the responsibility of having to go to work. Even though I've run a company, I have a business, but it's just that it's my agenda. It's not anybody else's agenda but my agenda. But the most important thing that has kept me is having that strong inter-spiritual peace and having that strong inter-peace of joy and loving people. And so that's just it in a nutshell. I just enjoy life.
Wow. Well, it's interesting to hear. Boy,
everybody knows why I'm happy. All the surgery that I've had, I'm just happy to still be alive.
Oh, yes.
30 years and counting. Huh?
Amen to that.
Well, there's so many different surgeries. I'm telling you.
Yeah.
Okay.
Okay. Well, this has been wow. What a session. Okay.
423.
Okay, this is yoga for skeptics.
No.
John, you want to run this down for us? Since you're a yoga participant, is it worth all of this talk, John Buchanan?
I believe it is. It's something that I've incorporated. I used to do it once a week, and it was difficult because I was so stiff. One of my scuba students, when I was struggling to put my fins on, he was Asian. He said, "You need yoga," and first I got mad at him, and then I figured that he might know what he's talking about. After I started taking yoga. And I was doing it for a couple of years, and then the pandemic hit. And since then, I've been doing it online. And if anybody's interested, in fact, I sent a link to you, Doc. I don't know if you're able to take advantage of it, but online yoga is good. You can play it back whenever it's convenient. And it's something that enabled me to, for the first time in my whole life, to meditate at the end. My mind was always going to the next thing, what's happening tomorrow, what's on the calendar. Yoga helps you to focus on now. It helps you to focus on breathing. It also has the benefits of stretching and strengthening muscles and muscle groups. But especially the breathing and the meditation part is pretty awesome. I recommend it. I heard about go-go yoga. So they have go-go music in the background while you're doing your yoga moves. It's pretty wild.
Okay, thank you very much. Any other comments about yoga? I think he expressed it very well, and it's something that's been around for quite a while now. 5,000-year history. That's pretty long.
Dr. Callender, before we go, there's one other article that we mentioned last week that we need to just touch on today.
Okay.
If we don't have time to touch on it today.
No, we have to. What article is it?
It's the article about how institutional racism causes stress in the Black community.
I think, okay, we can. Do you have that article, Buchanan? Because it's something that
I don't.
Yeah, here it is. It's right here. You can just touch on it.
Yeah, okay. Yeah. It's not, that's something that we know well because we've experienced it on a day-to-day basis. But let's leave this as a closing article.
Yeah, they did a study on Dr. Martin Luther King, and that's how they discovered that his heart and everything was twice as old as he was.
John, can you go back to the picture? Because the picture is worth 1,000 words. Thank you.
Okay.
So I'll send it to everybody. Carol already has it. I think, Carol, you have it too. Yeah, I'll send it to everybody. Talks a lot about heart disease.
Yeah, send it. If you send it to me, send it an email, because
Okay.
it doesn't do well on my text.
Okay. Will do. But hypertension and heart disease, COVID-19, all of these comorbidities in the Black community that we have is caused by this stuff. So, yeah, I'll send it out.
I think this is something that we all have to go through, and it's worth spending a lot of time on that in our next session. Next week I will be away. My grandson is graduating from college, so I will miss next Thursday. But when we meet again, that could be our lead article for the day, because it affects all of us. In every single day, it affects us. And that's why it's so important to be happy, because that's one way of dealing with stress. And, you know, we talked about the new president, and they talked about the nurturing and all of that that goes along with being in an HBCU. And what theoretically it is dealing with is trying to overcome the negative impact of institutionalized racism. And it's hard to overcome something that's been with us for 400 years. And that's why it's worthy of lead article status. Anyway, this has been a great session. It's been therapeutic for all of us to hear about how happy you are in spite of institutionalized racism and the different ways that we've managed to deal with it. Some by music, some by religion, some by yoga, some by, yeah. But that's just one of many things. Yeah. His music is therapeutic as well. It gives a lot of credit to yoga, but there are many other aspects of his life that make him the successful and happy man that he is. And that's true for each and every one of us who have different routes and different journeys that have led us to our destination. But I think it's important that we all learn the lessons that life teaches us as we go along the way, because we all have obstacles, and from my perspective, obstacles are stepping stones to success. And when we recognize this, including that obstacle of institutionalized racism, because there are many dreams we have. I know Charles Drew said that excellence of performance overcomes artificial barriers created by man. And in many ways, for some people, that's true. But for many people, that isn't true. Even though they have excellence of performance, they're still put down. But I think these are a part of the obstacles that can become stepping stones to our success and routes by which we reach happiness, the happiness which is different for each and every one of us. So until the 18th, I look forward to seeing all of you again. And thanks for attending. It's been a great session.
Dr. Callender,
Yes.
you're very modest, but how many grandchildren you have? And this grandchild that's graduating from college, what college and what's his major and all that?
Yeah, Caleb is my son's name, my son's name, and he's graduating from Virginia Tech, and he's his major is history and politics. None of my grandsons have any interest in medicine. My other grandson is a freshman at LSU, and he hasn't established a major yet. So that, but I can't miss this graduation. So I have to be away from you next Thursday.
Hey, how many grandchildren you have?
I have two, only have two.
Only two.
What
Not
about-
unlike you. How many grandchildren do you have?
Oh.
10.
How many?
10.
10.
Wow.
What about great grandchildren, Dr. Callender? Do you have?
No,
any?
I have none. yet.
Oh, and I asked that question because when you said grandchild, I have a great granddaughter that's in college. So
Wow.
Wow.
yeah,
Wow.
she's completed 3 years, 2 years, 3 years
Wow,
of college.
Wow.
Yeah.
What's her major?
Early childhood education. She got a
Wow.
full scholarship to Delaware State,
Wonderful. Wonderful.
and
Oh,
she
hey.
graduated from my alma mater, McKinley Tech.
Yeah, check.
How about that?
Yeah,
Okay.
so
All right.
that's my oldest great grand. So
Wow.
I'm a
Congratulations.
few years younger than you. That's why I just wondered, did you have any great
Yeah, I started very late.
I started very young.
Yeah.
Obvious.
Yes, I did. I don't mind saying it.
Yeah.
That's another reason why I'm happy, because I got it over with.
Wonderful, wonderful,
Yeah.
wonderful.
What you doing?
Pearlie, it's so good to see you. I missed you.
It's good to see you too, Dr. Callender.
Okay.
Ain't
All
cool.
right. Take care. Have a great week and see you when I get back.
She got a
All
scholarship.
right.
Oh,
Take care. Thank you.
okay.
all.
Bye-bye.
Bye-bye.
Have a good weekend.
Everyone, be safe.
Candy.
Yes,
You too.
Carol,
Yes.
thanks for the text. It's just that my phone can't respond to any text
I
that
think
exceeds
you're
10.
dealing with it.
Okay, that's what I send it to everybody by text, because someone sent it to me by text.
Yeah, well, thank
John
you so
sent it
much.
by email.
Yeah.
Okay.
Yeah,
I'll
I
send
got
it
it too, Carol. Thanks.
And John, you got my text message.